If you're over 65 and doing one simple thing every morning, you could be silently damaging your heart. I'm Dr. Robert Clark, and what I'm about to share with you today could be a literal lifesaver. I've seen countless patients in my practice who come in with new heart concerns, and when we start talking about their daily routines, this one habit almost always comes up. Many people, especially as they get older, think they're doing something good for themselves, but in reality, it's putting a tremendous strain on their cardiovascular system. Today, I'm going to pull back the curtain on this hidden danger, explain why doctors often miss it, and give you the simple, actionable steps you can take starting tomorrow morning to protect your heart for years to come. I want you to think for a moment about your morning routine. What's the very first thing you do after you wake up? For many of you, it's probably to get up and start your day, maybe head straight for the coffee maker or get dressed. But there's a specific action that's extremely common and can be a silent threat. I'm talking about suddenly standing up out of bed too quickly. Now, I know what you're thinking. What's the big deal? I've been doing that my whole life. But as we age, our body's ability to adapt to rapid changes slows down. When you go from lying flat to standing upright in an instant, your blood pressure can drop dramatically. This sudden drop is known as orthostatic hypotension, and it puts an immense, unnecessary strain on your heart as it struggles to pump blood up to your brain. This can lead to dizziness, lightheadedness, and in some cases even fainting or falls. But more concerningly, it's a warning sign that your heart's ability to regulate itself is faltering, and it's a habit that contributes to long-term cardiovascular stress. It's like flooring the gas pedal in a car that's been sitting in the cold all night. It puts a lot of stress on the engine. You might be asking yourself, why haven't my doctors warned me about this? That's an excellent question, and it gets to the heart of the issue. In a typical 15-minute office visit, your doctor is focused on a battery of tests, checking your blood pressure while you're seated, listening to your heart, and reviewing your lab results. They're looking for major risk factors like high cholesterol or AFib. They simply don't have the time to ask about the micro habits of your morning routine. It's a quick snapshot, not a full-length film of your daily life. I remember a patient of mine, let's call her Margaret, a wonderful 75-year-old woman who was otherwise very healthy. She came to me after a dizzy spell that caused her to fall in her kitchen. Her blood pressure was normal in my office, her labs were good, but when I asked her to describe her mornings, she said she practically leaps out of bed to get her day started. The fall, we realized, was a direct result of her body not being able to keep up with that sudden change. The habit, though seemingly benign, was a risk factor hiding in plain sight. It's why it's so important to be an active participant in your own health and to pay attention to these small details. Let's dive a little deeper into the science behind this risk, but I promise to keep it simple and easy to understand. Your body has an amazing system called the autonomic nervous system. Think of it as the body's autopilot. Its job is to maintain balance, like keeping your blood pressure stable no matter what position you're in. When you're young, this system is incredibly robust. You can jump out of bed, and it instantly constricts your blood vessels and increases your heart rate to keep blood flowing to your head. It's a seamless process you never even think about. But as we get older, this system becomes less responsive. The blood vessels lose some of their elasticity, and the nerves that regulate blood pressure can become a little sluggish. This is why that simple act of standing up quickly can cause such a problem. Your body can't make the necessary adjustments fast enough. It is like a car with worn-out shock absorbers. It can't handle the bumps in the road as well as it used to. This isn't a sign of weakness, it's a natural part of the aging process, which is why we have to be more mindful of these seemingly small habits. The good news is that the solution to this problem is incredibly simple and effective. It's a matter of slowing down and giving your body the time it needs to adjust. Instead of leaping out of bed, I want you to try what I call the 3-step morning routine. First, when you wake up, take a moment to just sit up slowly in bed. Don't rush it. Take a few deep breaths and sit there for about 30 seconds. Next, swing your legs over the side of the bed so your feet are on the floor. Take another 30 seconds to just sit on the edge of the bed. Wiggle your toes, maybe flex your ankles. This gives gravity a chance to do its work without overwhelming your system. Finally, and only then, do you stand up slowly. This entire process takes less than 2 minutes of your morning, but it can make a world of difference for your cardiovascular health and your safety. You will likely feel a lot less dizzy, and you'll be significantly reducing your risk of a fall. The best part? You'll likely notice the positive effects almost immediately, within the first few days of making this small change. I have another very practical tip for you that I recommend to all my patients. Your bedroom can be a bit of a tricky environment, especially if you're older. It's often dark, and you might be disoriented when you first wake up. So another simple solution is to have a glass of water on your bedside table. Before you even sit up, take a few sips. This helps increase your blood volume, making it easier for your body to maintain stable blood pressure when you eventually stand. Additionally, consider having a pair of glasses and a small non-glare nightlight near your bed. Better vision and a little bit of light can make a huge difference in your confidence and stability when you re-getting up. This might seem like a small thing, but for someone like my patient, Margaret, it helped prevent another scary fall. These aren't just tips, they are small daily investments in your health and safety. Let's also talk about the timeline for seeing results. Unlike some medications that take weeks to work, you can feel the benefits of this new morning routine almost immediately. The very first morning you try it, you will likely feel less lightheaded and more stable. Over the long term, by removing that daily strain on your heart, you're strengthening your cardiovascular system. The consistency of giving your body time to adjust each morning helps your autonomic nervous system function more efficiently. It's like consistent, gentle exercise for your blood vessels. The goal here isn't to fix one problem, it's to build a foundation for better health. Have you ever noticed that you're a little more unsteady on your feet first thing in the morning? That's your body's subtle way of telling you it needs a little more time. Listen to those signals. They're your body's way of communicating with you, and paying attention to them can be the key to preventing a much more serious event down the road. To wrap things up, I want you to remember these 3 key takeaways. First, stop the habit of jumping out of bed. Give yourself a moment to transition from lying down to sitting, and then from sitting to standing. Second, try the safer alternatives we discussed. Sit on the edge of the bed for a moment and consider keeping a glass of water handy. And finally, keep track of your progress. Notice how you feel. Do you feel less dizzy? More stable? Celebrate those small victories because they are proof that these small changes are making a huge difference for your heart. These are not drastic lifestyle changes, they are simple, conscious choices that can add years of health and independence to your life. If this video was helpful to you, please subscribe for more expert health advice for seniors. Your support helps me reach more people with these important messages. Also, leave a comment below if you've ever felt dizzy or lightheaded in the morning. Let us start a conversation and support each other. Finally, don't miss my next video where I'll be discussing the 5 subtle warning signs that your heart is in trouble that most people completely ignore. Thank you for being here with me today.